MMT, foot inversion, tibialis posterior. Assist the patient to the short sitting position with the ankle in slight plantar flexion. The trunk may be supported by placing the hands flat or fisted at the sides or by leaning the trunk slightly. Sitting on a low stool slightly in front and to the outside of the test foot. Passively move the patient's ankle through plantar flexion and foot through inversion. You're not assessing the infield, you're determining how much range the patient is available to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to plantar flex the ankle and invert the foot as you observe for any substitutions. Stabilize the patient at the posterior aspect of the leg just proximal to the ankle. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include using the flexors of the toes to assist with the motion. Instruct the patient to keep the toes relaxed. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the posterior aspect of the leg just proximal to the ankle. The other hand is placed over the dorsum and medial side of the foot at the level of the metatarsal heads. This hand will apply the resistance in a direction toward eversion and slight dorsiflexion. Apply the force for a 5-second count. Grade 5, normal. The foot inverted to the available range of motion and the patient was able to hold the end position against maximal resistance with no break in the position. Grade 4, good. Foot inverted to the available range of motion and the patient was able to hold against strong to moderate resistance. Grade 3, fair. The patient is able to move through all the available range of motion in foot inversion but is unable to tolerate any resistance. There is no position change for grade 2, 1, or 0. Grade 2, poor. The patient completes partial range of motion only. For grade 1, palpate the tendon of the tibialis posterior between the medial malleolus and the navicular bone. You may also palpate the tendon just above the medial malleolus. Grade 1, trace. Palpable contractile activity at the tendon of the muscle with no joint movement. Grade 0, no palpable contraction.